Who brought it here? I need to.
स्क्रीन टच कर दो
ठीक है
स्टॉप ना बाकी बातों फोन चेक कर लेते हैं
Non-factoring?
Charlie, are you?
I have a link, so you can go off of here or you can put your own. किसे वो भेजना है? Link भेजता हूँ हाँ live yes तुसी भी restaurant हाँ मैं yes करके आया Okay, just be the restroom दिखा दो
Right on the corner.
So we are just gathering in about 5 minutes which ਸ਼ੁਰੂ ਕਰ ਦਿੰਦੇ ਹਾਂ ਬਸ they have just made it ਤੇ ਲਿੰਕ ਇਹਨਾਂ ਨੇ ਪਾਤਾ ਹੈ ਉਹਦੇ ਵਿੱਚ ਗੁਰਦੁਆਰੇ ਦੇ ਜਿਹੜੀ ਡਿਸਟ੍ਰੀਬਿਊਸ਼ਨ ਲਿਸਟ ਵਿੱਚ ਸੋ ਜੇ ਕਿਸੇ ਨੂੰ ਚਾਹੀਦਾ
Let's see.
Focus on the slides just a bit more so than the speaker.
Okay.
Yeah, I think slide can yaad rahi hai.
अच्छा
Slides.
Yeah.
They don't show up, right?
It's only
Poster.
yeah, it's
No, I'm saying
yeah, the
slides
slides
posted anyway. None of the slides are posted.
Slides are it's just and I used to post them.
maybe go interest from music
Person versus
Even this link to this should be computer upstairs and posted.
that's right.
You can go to YouTube and search.
Yeah.
There's so many things that we must organize.
That's team work है ना सारे इंसान
Point fingers for sure. Point fingers.
चार अपनी तरफ हो गए
How are you?
नहीं ऐसी एंटी क्लाइंट
Next door to see you this one.
बस
Better?
It's crazy.
Yeah. We were there for 2 weeks, 2.5 weeks. Take care. It's better when somebody's
check with you
better when somebody's there.
I was working for an automotive supplier
But yeah.
they had a bunch of people where you got laid off internal auditor he's looking
Yes,
applying
yes. So they're home for a week.
you don't have any
6 weeks, you're going to.
Okay, I mean, I work for a company in California, right? So I think it's better to get Street and Sharanjeet and all these guys in the local. Sanjay?
Could be ideal.
Oh, he doesn't mind.
Yeah, true.
Yeah. He was in finance.
You know, finance auditing, internal auditing.
You should try these Ernst & Young, these consulting companies.
What's that?
I don't know, I'm sure he knows that.
Yeah.
Let me see who's that.
Those guys are like the big, Anderson, they all do
Yeah.
financial auditing for big companies, right?
Oh,
But also he was working with the state, I thought.
no, that was when he
I'll find
registered
something
in
who's
school.
in it and then they
And he left that COVID.
Oh, okay.
And then he working for this Delphi, which is a GM.
Right.
He used to be a subsidiary and it's an Irish company.
Yeah.
And they,
Oh, Surinder, है ना? Who's that Bendy or Ravi Bhallavi?
Yeah.
yeah. Oh, okay, what did he do?
Ravi Bhallavi.
Yeah, no. His sister is
What's her name?
She's some weird name.
Her husband is Surinder. He used to work at that farm, or I think he still does. And he actually moved to Ireland for many years. My family moved back.
Well, that's the company.
But that's a field where it's not specific to one market. You can go into any market.
Yeah.
That's the advantage.
Also, can I take care of this? Good to see you. Thank you for coming and making this very meaningful presentation.
Yeah, we're excited to get started. VG, just before VG said to wait for him to, he'll be just right back.
Yeah.
Yep, so then we'll start. Wait, good, how are you?
Thank you for inviting us.
How are you doing? Good to come visit. Oh, Katrina. Okay.
We do the same job, different hours.
Acha?
Yeah. Outpatient psychiatry.
Where?
Henry Ford?
Where?
Oh, Troy. Yeah. We go like, ajkal sort of virtual chal raha hai, so we just go like 1 day a week. Yeah.
Yeah.
But that could change.
Or you said different hours mean what?
Like, she works like, part-time and I.
Okay. Go in. Okay. I'll see you.
Yeah.
Yeah.
It's been just for a long time, right?
और तेरे काम के अंदर चल रहे हैं?
It's good, slowing down, coming back.
Oh, nice.
He's getting old, basically.
No, he's not getting old. Then you're telling me I'm getting old.
No, he said he's slowing down. You're not slowing down.
That's a very sensitive thing. You know, kids have started calling me Uncle G. That's also sensitive.
That's right. That's right.
Friends in college because we were going on.
That's
Yeah.
okay.
That's okay. That's part of
It's
the,
okay.
That's part of the journey.
I've accepted.
Part of the psychiatry and Gurbani.
Yeah.
You're waiting for something?
Yeah, we're just waiting for just because I think he said he was just gonna come right back. Oh, awesome. So should we use the cookie?
Yes, you can use it.
Test.
वाहिगुरु जी का खालसा, वाहिगुरु जी की फतेह. So I think we are also broadcasting live through YouTube. Link by just pasting in a page. So those who can't come, please share link with your friends. So it's my honor to actually welcome Dr. Simran and Dr. Mansi Chawla. They're both psychiatrists, and they've done quite a bit of work in translating Gurbani, and in their profession they actually have done a nice job linking the two things as a way to advance this forward. And let's do a Jakara to welcome them here. And my only request is that we try to keep one question per person as a way to continue to, advance their talk, and then they'll be available later for more interaction. Waheguru Ji Ka Khalsa,
Waheguru Ji Ki Fateh. So we'd like to thank Jasprit Vir Ji, Dr. Harminder Singh Ji, and the committee for inviting us to speak today. So the topic that we'll talk about is psychiatry and Gurbani. So how does Sri Guru Granth Sahib Ji approach mental health? So we'll go ahead and get started.
Is there a way we could keep this closer because we don't really present it, or can someone change the slides?
I can change the slides.
So as you can see on this first slide, we have this quote from Japji Sahib, Man Jeete Jagjeet, conquer your mind and you have conquered the world. So Gurbani sanu aise passe landi hai, please sade andar di duniya, sade man di duniya. So see, ide bare hor elaborate karenge. So if we think about Sri Guru Granth Sahib Ji, it's a very mind-oriented scripture and it's very unique. Yes? Oh, Hanji.
Your shadows on the slide. So.
Oh, okay, that's a good point. Maybe we can switch.
We can move the podium.
Yeah.
The podium then.
This is better. Is it
Yeah.
too tight?
Need to.
There's enough room.
Okay, very good. So Sri Guru Granth Sahib Ji actually has a very specific theory of mind. So what do we mean when we say theory of mind, right? It's what explains our behavior, what explains why we do what we do. So Guru Granth Sahib Ji walks us through negative emotional states as well as positive emotional states. And it also, there's a lot of shabads, and there's a central concept in Sri Guru Granth Sahib Ji about home, which literally translates to ego, or also our sense of self. And there's also a concept of Maya, which literally translates to illusion, and how this force of Maya, which is invisible, acts upon the mind and kind of blinds it to the presence of God and prevents us from accessing that stable state of mind that's full of those positive emotional states, which we'll get into. So Guru Granth Sahib Ji has a very distinct theory of mind that if we try to understand it, it's very relevant to our psychology and how we can attain well-being.
Okay, so now let's talk about the 5 thieves, or the Panchor, as you may already know. These are Kam, which is lust, Krodh, which is anger, Lobh, which is greed, Moh, which is attachment, and Ahankar, which is egotism. And we'll talk about why we call them the 5 thieves in the next few slides. So these are the main 5 negative forces, but there are several offshoots of these 5 forces that can affect our quality of life in a significant way. So these include jealousy, which is also described as Parka Bura, or Irak or Jalan in Guru Granth Sahib Ji. Anxiety, which is also described as Parishani, Fikr, Kadha, Chinta, and depression, which is also described as Santap or Dukh. And all of these bind the mind to Maya, which is illusion, and it takes us away from the very source of happiness and ultimate peace and Sukh, which is Vaheguru. As long as we have the false sense of self, or home, as long as we are not able to overcome it, we can never remain in a positive or stable state of mind. We can have glimpses of peace or happiness, but there will be a lot of misery and sadness until we are able to overcome this mind. And in Guru Granth Sahib Ji, the biggest rogue is actually not any physical illness, but home. It's been described as the most terrible disease according to Guru Granth Sahib Ji. Next slide, please.
Yeah, so as Matsi said, so the Panch Chor are central concept in Guru Granth Sahib Ji, and these are all, like, if we think about it, these are all psychological. Now, why did Guruji describe these as chor, right? Why not emotions? Why not forces? It's because they literally steal from us, and this is what Gurbani actually tells us. So it says, "Is dehi mein panch chor vase." Inside this body, within the mind, there reside 5 thieves. And why are they called thieves? Or what are these? Kam, Krodh, Lobh, Moh, Hankara. What do they do? Amrit lute. So normally when we think of the word Amrit, we think of the sacred water that's given at the Khande Dipo ceremony, right? But the Amrit in Gurbani is a spiritual Amrit. It's an Amrit that's already within us. There's verses in Gurbani that explain this. Antar ka hutta Amrit parya. So there's already a well of Amrit that's inside of us, which Amrit could be thought of as our life energy, which is immortal, right? Our life energy is always there, even though we may change forms, we may go through different incarnations, but our life energy is always there, and that's the Amrit, the immortal life energy. But the Panch Chor prevent us from accessing it. They rob us of this energy, and they make us tired, they make us miserable, they kind of draw us in. And even jada ਅਸੀਂ ਨਾਮ ਵੀ ਜਪਦੇ ਹਾਂ, ਉਹ ਜਿਹੜਾ ਨਾਮ ਜਪਣ ਵੇਲੇ ਜਿਹੜਾ ਅੰਮ੍ਰਿਤ ਅੰਦਰ ਪੈਦਾ ਹੁੰਦਾ ਹੈ, ਇਹ ਪੰਜ ਚੋਰ ਪੀ ਪੀ ਕੇ ਤਕੜੇ ਹੋ ਜਾਂਦੇ ਹਨ. And so unless we learn how to restrain these 5 thieves, unless we learn through Gurbani ਵੀ ਗੁਰਮੁਖ ਬਣ ਕੇ ਅਸੀਂ ਇਹਨਾਂ ਤੇ ਕਿੰਦਾ ਕਾਬੂ ਪਾਣਾ, we can never achieve a stable state of mind. So it says ਅੰਮ੍ਰਿਤ ਲੁੱਟੇ ਪਰ ਮਨਮੁਖ ਨਹੀਂ ਬੁੱਝੇ. ਜਿਹੜੇ ਆਪਣੇ ਮਨ ਦੇ ਮਗਰ ਲੱਗੇ, those who follow their own mind at the expense of the Guru's instructions, Manmukh nahi bujhe, koi na sune pukara. They suffer silently. Nobody can hear their cries of misery, because that's the natural mental state of if we fall into being a Manmukh, versus a Gurmukh, somebody who's waging war against these 5 thieves and trying to overcome them.
So, Guru Granth Sahib Ji is unique among scriptures in that many shabads are actually direct conversations with the mind rather than parables or stories told to people. So, there are a lot of words in Gurbani that describe mental states, and these are some of the negative mental states described in Gurbani. So, Dukh, which is pain and suffering, Rog, which is illness, and that includes mental illness, Kalesh, which is inner conflict, Jalan, which is burning, Trishna is uncontrolled desire, Pukh is hunger, anxiety has been described as fikr, parishani or chinta, and Sog, which is despair.
Where there are negative mental states, there are also positive mental states. And we want to emphasize this isn't an exhaustive list, but these are ones that appear very frequently in Sri Guru Granth Sahib Ji. So these are Sukh, which is peace and happiness, Sahaj, which is spontaneous calm, Anand, which is a sense of blissfulness, Vigas, which you read in Japji Sahib every day, it's a feeling of blossoming, inner blossoming, feeling of chao or enthusiasm, and a feeling of vismad or wonder. These are the positive mental states that Guruji describes. So the central question is, how can we go from constantly being in those negative states of mind, constantly being in their grip, towards positive states of mind, and that too not just for a few days, not just for a few minutes or a few hours, but permanently? How can we prevent ourselves from our default state being that of Dukh? So adopting virtues and meditating on God's name, that's the central idea of Guru Granth Sahib Ji, and within that all of the transformation is contained. So against each negative force that we described, like Kam, Krodh, Lobh, Moh, Hankar, there's a positive force that we can try to adopt in our daily life. However, ਜੇ ਅਸੀਂ ਆਪਣੇ ਜੋਰ ਨਾਲ ਗੁਣ ਧਾਰਨ ਕਰੀਏ, ਉਹ ਗੁਣ ਟਿਕਣਗੇ ਨਹੀਂ, ਕਿਉਂਕਿ ਉਹਨਾਂ ਨੂੰ ਫਿਰ ਹਉਮੈ ਪਕੜ ਲੈਂਦੀ ਹੈ. So the ultimate way to overcome those negative forces, ਜਿਹੜੇ ਪੰਜ ਚੋਰਾਂ ਦੀ ਤਾਕਤ ਨੂੰ ਘਟਾਉਣ ਲਈ, is ਨਾਮ ਜਪਣਾ. That's something that ਹਰ ਇੱਕ ਸ਼ਬਦ ਵਿੱਚ ਹੈ ਸਾਨੂੰ ਉਪਦੇਸ਼ ਮਿਲਦਾ, ਨਾਮ ਜਪਣ ਦਾ. ਕਿਉਂ? ਕਿਉਂਕਿ ਨਾਮ ਵਿੱਚ ਹੀ ਉਹ ਤਾਕਤ ਹੈਗੀ ਹੈ ਜਿਹੜੇ ਪੰਜ ਚੋਰਾਂ ਨੂੰ ਕਾਬੂ ਕਰ ਸਕਦੀ ਹੈ. So without remembering God's name, no positive virtue can remain with us, and that's actually in our Nit name. Man ek na chetas mood mana, O mere murukh man, O my foolish mind, tu ek nu nahi chetna. You don't remember the one God. Har bisrat tere gun galya. Without remembering God, there is sare gun gal jange. Sare gun they'll wither away. So, and Gurbani tells us, without a gun taran kitan to bina, we can't have a stable peace of mind, and bhakti bhi nahi ho sakti. Vin gun kite, in Japji Sahib we read, Vin gun kite bhagat na hoy. So, sab to pehla we have to adopt a virtuous life and meditate on God's name, and ide naal, in addition to adopting the qualities of being a Gurmukh, we can overcome these negative states of mind.
So now let's talk about the 5 virtues against the 5 thieves. So against Kam, which is lust, Guru Granth Sahib Ji has prescribed Jat, which is control of senses. Against Krodh, which is anger, there is Daya, which is compassion, Khima, which is forgiveness. Against Lobh, which is greed, Guru Granth Sahib Ji has prescribed Santokh, which is contentment. Against Moh, which is attachment, there is Vairag, which is dispassion or detachment. And against Ahankar, which is pride or egotism, there is Garibi, which is humility.
But this is what we alluded to earlier. Practicing virtues is just the beginning. Like Guru ne sanu hathyar ditte hai, pi jado sanu, for example, krodh ave. जैसी कोई गुरबाणी दी तुक नु चेते करिए, like फरीद दा बुरा दा भला कर, गुस्सा मन ना हंडाए, देही रोग ना लगे, पल्ले सब कुछ पाए. If you remember the lines of Gurbani during those difficult times, then we're able to practice these virtues. We're able to practice the forgiveness. We're able to keep the presence of mind so that anger doesn't overwhelm us. So that it doesn't sadi babek buddhi nu ni khonda gussa, jaisi Gurbani nu yaad kariye. But ultimately, jo assi pehla kaise bhi naam to bina virtues jehda andar tik nahi sakte, kyunki gun nidhan har nama. Naam jehda hega is a treasure of God's virtues. Sare jehde Paramatma de gun naam vich ਵਸੇ ਹੋਏ ਹੈ ਤੇ ਜਪ ਪੂਰਨ ਹੋਏ ਕੰਮ ਹੈ. ਜੋ ਅਸੀਂ ਨਾਮ ਨੂੰ ਸ਼ਰਧਾ ਨਾਲ ਭਾਵਨਾ ਨਾਲ ਜਪੀਏ ਤੇ ਸਾਡੇ ਸਾਰੇ ਕਾਰਜ ਰਾਸ ਹੋ ਜਾਂਦੇ, ਸਾਰੇ ਕਾਰਜ ਪੂਰੇ ਹੋ ਜਾਂਦੇ. ਇਹ ਦੋ ਤੱਕ ਇਹਨਾਂ ਬਾਰੇ ਅਸੀਂ ਗੱਲ ਚੁੱਕੇ ਵਿਣ ਗੁਣ ਕੀਤੇ ਭਗਤ ਨਵੇਂ ਭਗਤੀ ਦਾ ਮਾਰਗ ਸੰਪੂਰਨ ਨਹੀਂ ਹੋ ਸਕਦਾ ਜਿੰਨੀ ਚਿਕਰ ਅਸੀਂ ਗੁਣ ਧਾਰਨੇ ਸ਼ੁਰੂ ਨਾ ਕਰੀਏ ਤੇ ਇਹ ਪਰਮਾਤਮਾ ਨੂੰ ਯਾਦ ਕਰਨ ਤੋਂ ਬਿਨਾਂ ਸਾਡੇ ਸਾਰੇ ਗੁਣ ਹਉਮੈ ਦੇ ਵਸ ਪੈ ਜਾਂਦੇ. And this is something that we wanted to go, because it's a very subtle point. So to achieve a steady mental state, we have to become a Gurmukh. So we really have to understand what exactly is a Gurmukh, what exactly is a Manmukh. So Gurmukh de te arth siddhe, right? Somebody who's Guru facing. Jida Mukh Guru wal hega. So somebody who accepts the word of Gurbani is true, even though we may not understand why it's true, right? So, जो असी डॉक्टर को जाते सानू शायद पता ना होए कि प्रिस्क्रिप्शन की करती है, क्यों काम करती है, पर असी डॉक्टर के कहने ते ले लेंगे. सो इसी तरह गुरमुख जिहड़ा बनने की कोशिश कर रहा है, उन्हें ऐ नहीं पता भी मैं मे बी ऐ ना पता होए भी मैं क्यों फॉलो कर रहा हूँ, पर उन्हें गुरु के बचना ते श्रद्धा रखता है. He accepts the word of the Guru as true and tries to follow it toward the best of his or her ability. But Manmukh ki again, Manmukh is somebody who literally faces their own mind. Meaning, whenever they have a major decision to make, whenever they decide what's the right behavior, they consult their own, whether it's their upbringing, their mind, even if it's their code of ethics, whatever it is, but it's all derived from source other than the Guru. Now, this is a subtle point. A Gurmukh and a Manmukh, we're not saying that a Manmukh is a bad person. It's not commenting on whether somebody is a good or a bad person. But there are very clear outcomes of being a Gurmukh and a very clear outcome of being a Manmukh. Somebody who follows their own mind's instructions, what Gurbani tells us, jehda apne man de magar lagda hai, they'll be stuck in repetitive behaviors that inevitably wo dukh pande. Inevitably it results in pain and suffering, even if it remains logical, even if it looks logical. For example, if we look at our society, right, it seems logical to spend your whole life just concerned with earning money. It seems logical to spend your whole life just involved in, your daily responsibilities and not really worrying too much about spirituality, or not really, idhar dhyan nahi na dena. That's what most people do. Like, that's what society reinforces, that materialism. So even if it seems logical, it's something that the Manmukh gets stuck in those kind of patterns. So then for naturally jado dukh bande nu lagda, then you ask, like, is there something beyond this? So, but that doesn't mean a Manmukh is a bad person. It's just that ਉਹਨਾਂ ਦੇ ਇਹ ਹੈਗਾ ਕਿ ਉਹ ਗੁਰੂ ਦੀ teaching ਨੂੰ accept ਨਹੀਂ ਕਰਦੇ, ਗੁਰੂ ਦੀ teaching ਨੂੰ follow ਨਹੀਂ ਕਰਦੇ. So, in following the Guru's instructions, even ਜੇ ਸਾਡਾ ਮਨ ਨਾ ਵੀ ਮੰਨੇ, right? Even ਜੇ ਸੇ ਪਹਿਲਾਂ ਸਾਨੂੰ ਲੱਗੇ ਵੀ ਅਸੀਂ ਕਿਉਂ ਕਰ ਰਹੇ, right? ਅਸੀਂ ਕਿਉਂ time ਲਾ ਰਹੇ ਹਾਂ? ਸਾਨੂੰ ਪਤਾ ਹੈ ਜੇ ਅਸੀਂ ਗੁਰਮੁਖ ਬਣਨ ਦੀ ਕੋਸ਼ਿਸ਼ ਕਰ ਰਹੇ ਹਾਂ, ਸਾਨੂੰ ਪਤਾ ਹੈ that the Guru is all wise, ਤੇ ਉਹਨਾਂ ਨੂੰ ਪਤਾ ਹੈ ਸਾਨੂੰ ਕਿੰਨਾ ਸੁੱਖ ਦੇਣਾ ਹੈ, ਸਾਨੂੰ ਕਿੰਨਾ ਆਨੰਦ ਦੇਣਾ ਹੈ, and eventually ਉਹਦਾ ਫਲ ਜ਼ਰੂਰ ਲੱਗਦਾ ਹੈ. ਜਿਹੜਾ ਅਸੀਂ ਨਾਮ ਜਪਦੇ ਹਾਂ, ਜਿਹੜੇ ਅਸੀਂ ਗੁਰਬਾਣੀ ਪੜ੍ਹਦੇ ਹਾਂ, ਉਹਨੂੰ ਸੁੱਖ ਦੇ ਫਲ ਹਮੇਸ਼ਾ ਲੱਗਦੇ ਹੈ. And this is a verse from Gurbani that kind of reinforces what we're talking about. So, jitne narak se manmukh bhoge gurmukh leb namasa hai. So, it says jitne narak. And narak doesn't have to be a physical place, psychological hells, right? Narak de, it's like a completely separate thing, whether it's a physical place or not, but ithe kinne narak hai, right? Dukh, chinta, santap, kalesh, so many different types of narak. Jede sare narak jede manmukh ona da bhagi banda hai, all of the naraks that the manmukh has to go through, gurmukh lep namasa. Gurmukh is not even touched by that, because they're shielded by the Guru's teachings, by following and accepting the Guru's teaching.
So now let's talk about how Gurbani guides us in our mental health journey. Next slide, please. So Guru Granth Sahib Ji, as we discussed, it's rare among scriptures that it addresses the mind directly. And many hymns are not, instructions to disciples. They are actually direct conversations or a direct dialogue with the mind. And the importance of analyzing thoughts, the importance of analyzing, mental patterns, it gained importance in the West in the 19th century by Freud and Jung with the birth of psychotherapy. But over 500 years ago, the Gurus already recognized the importance of mind. Rather than external causes, the root of our problem lies in our own thoughts and inner patterns. In Guru Granth Sahib Ji, there is a verse that says, Sagal Srisht ko Raja Dukhiya, Har ka naam japat hoy sukhiya. That essentially, is contrary to what we would think, ki jide ko sab kuch hai gaye, power, money, that person should be the happiest, but it's actually contrary to that. Next slide, please.
So, like Mansi said, the Gurus were way ahead of their times in recognizing that the mind is the source of all the problems. And just 200 years ago, Jung and Freud started looking at the mind and its patterns as sources of depression, anxiety. But there is a point where psychiatry and Gurbani diverge. For example, Sarde field, which psychiatry is only concerned with something if it affects our ability to function in relationships or at work. So, for example, we talked about home or sense of self, right? So the goal of psychiatry and psychology is to integrate the sense of self so that it's healthy, so that it no longer is so dysfunctional that we can't fulfill our responsibilities. But Gurbani goes one step beyond that, in which it's definitely not a bad thing to have an integrated sense of self that allows us to function. But Gurbani kehda bhi home nu surrender karo, home nu gavao, right? So it goes one step beyond psychology and psychiatry. Because even if we have an integrated sense of self, right? Gurbani sanu daste jinni chikar sade vich home hegi hai. As long as we're identified with home, the 5 thieves, kadi sanu sukh hoega for a few moments, par mostly dukh hoega. But Gurbani takes us beyond that and says surrender your home so that you can have sukh at all times. And Guruji actually says this in Gurbani, Jo sukh ko chahe sada sharan ram ki le. Right? And sharan doesn't mean necessarily physically sharan lo, bhi home nu surrender karo, uhi ege Guru di teaching nu follow karo, uhi ege pi jada Paramatma di sharan nu lena. So Gurbani kind of is interested in our mental state even if it doesn't cause dysfunction, right? So there are millions of people that carry out their responsibilities, that carry out their daily life, but with tremendous suffering, right? Tremendous daily anxiety, suffering, sense of feeling unwell, just a state of mind that they themselves would describe as almost intolerable, but they're still able to get through life. So Gurbani is concerned beyond just our ability to function in relationships or at work. This is apparent because Gurbani addresses things that are not psychological disorders. For example, there's no medication in psychiatry to treat jealousy, right? There's no medication in psychiatry to treat, oh, you're very narcissistic, you're very egotistical, right? So there's no medicine that can address that, but Gurbani is concerned with those states of mind. So that's where, while there is a big overlap between Gurbani and psychiatry, that's where they diverge.
Okay, so now that we've talked about the theory of mind, let's hone into specific psychiatric conditions, and we can start with depression. So depression is different than day-to-day ups and downs in life. We all feel sad when something bad happens, but that's just a part of being human. It becomes a psychiatric condition when it is so intense that it starts affecting our quality of life, our ability to function, our ability to have relationships. And that's when we need to treat it from a psychiatric point of view. And those who struggle with depression, they often describe it as a loss of their personality, a feeling of numbness. Next slide, please. So according to the DSM-5 criteria, and DSM is the Diagnostic Statistical Manual. In psychiatry, it's one of the most important books that is used to diagnose psychiatric condition. So depression is diagnosed with the following symptoms that need to be present for at least 2 weeks continuously. And at least one of the symptoms needs to be either sad mood or depressed mood most of the day. And the second one is anhedonia, which is reduced interest or pleasure in daily activities. The other common symptoms include significant weight loss or weight gain when you're not voluntarily trying to lose weight or gain weight. Not being able to focus on things, which starts affecting your ability to function at work, in school, disturbed sleep patterns, fatigue or loss of energy. It's not that you're exercising a lot and that's why you're feeling fatigued, but just that mental drain that comes from depression. Slowing down of thoughts, slowing down of physical movements, and our patients commonly describe it as, my limbs are feeling heavy, and oftentimes their families and friends are able to notice it too. Feelings of worthlessness or guilt, and even if they're not responsible for something, people start feeling guilty about those things. And sometimes it becomes so severe that people can have suicidal thoughts. And as we know in this country, suicide has become a major epidemic. So this makes it even more important to timely diagnose depression and treat it appropriately. So some of the common myths about depression are that there always has to be an external cause. ਅਸੀਂ families ਵਿੱਚ ਵੇਖਨੇ ਆ ਕਿ ਕਿਸੇ ਨੂੰ ਜੇ depression ਹੋਏ ਤੇ ਲੋਕੀ ਉਹਨਾਂ ਨੂੰ ਕਹਿੰਦੇ ਆ ਕਿ you have so many blessings, you have this, you have that, why are you so depressed? So it's like putting pressure on a person. And now ਜਿੰਨੀ ਵੀ ਸਾਡੇ ਕੋਲ ਨਵੀਂ research ਹੈਗੀ ਹੈ in depression, we are discovering that there is biological basis, there is genetic basis. If somebody has depression in the family, there is a higher risk of the successors of that person to have depression. And it's just like any other medical condition. ਜੇ ਕਿਸੇ ਨੂੰ diabetes ਹੋਏ ਜਾਂ hypertension ਹੋਏ ਜਾਂ ਕੋਈ ਹੋਰ ਇਹੋ ਜਿਹੀ medical condition ਹੋਏ, you're not going to tell them ਕਿ ਤਗੜੇ ਹੋਵੋ ਤੁਸੀਂ why are you doing this or why are you feeling this way. So just like that, depression is a medical condition and it has to be treated that way. So the understanding of psychiatry and psychiatric conditions has come a long way, thankfully. Previously, ਲੋਕੀ ਕਹਿੰਦੇ ਸੀ ਕਿ ਉਹ ਫਲਾਣੇ ਨੂੰ ਭੂਤ ਚਿੰਬੜ ਗਿਆ ਹੈ ਜਾਂ ਫਲਾਣੇ ਨੂੰ ਇਹ ਹੋ ਗਿਆ ਹੈ, and there were mental asylums. People were chained. There was absolute, very, very aggressive and very, very inhumane methods of treating psychiatric conditions. And the more understanding we've gained, we've understood that depression or psychiatric conditions are very similar to medical conditions. And it's not कि कोई अपनी volition नाल या अपनी मर्जी नाल depressed होके बैठे. And there is a lot of social stigma surrounding these conditions. So India, which, you know, when I was practicing, ਮੇਰੇ ਕੋਲ ਕਿੰਨੇ parents ਆਂਦੇ ਸੀ ਕਹਿੰਦੇ ਸੀ ਕਿ ਜੀ ਕੁੜੀ ਨੂੰ depression ਹੈ ਪਰ ਅਸੀਂ ਇਹਦਾ ਇਲਾਜ ਨਹੀਂ ਕਰਾਣਾ ਕੱਲ ਨੂੰ ਕਿਸੇ ਨੂੰ ਪਤਾ ਚੱਲ ਗਿਆ ਤੇ ਇਹਦਾ ਵਿਆਹ ਕਿਵੇਂ ਹੋਏਗਾ. So there was so much stigma around psychiatric conditions ਕਿ ਲੋਕੀ ਆਪਣੇ family members ਨੂੰ ਵੀ ਨਹੀਂ ਦੱਸਦੇ ਸੀ ਕਿ we are seeing a psychiatrist or a therapist, or you know we are seeking help. So it's very important to spread awareness about psychiatric conditions ताकि लोकी होर इन्हां नूं normalize करन, इन्हां नूं समझन ते इहदा timely इलाज करन.
So Mansi talked about depression as a psychiatric condition, you know, and the importance of recognizing it, getting treatment. But what does Gurbani say about this subject? And so we're very fortunate in that Gurbani addresses this topic, in that there's actually an article in the literature that asks this question: does Guru Granth Sahib Ji describe depression? And the articles are very interesting because it describes shabads in which this state is mentioned: not desiring food and water, being in a continual state of sadness. So Guru Granth Sahib Ji says that as long as we are separate from the source of happiness, jada sukh data, sukh da sagar, we're destined to be in a state of dukh or misery, in a state of misery, sadness. Now that degree of misery and the degree of sadness may vary, but it's not possible to achieve that complete sense of well-being without spirituality, without connecting with Naam, without connecting with Vaheguru. The other perspective of Gurbani, which it kind of balances us, because it tells us that sukh and dukh are not separate from each other, right? ਹੁਣ ਜਿਹੜੇ ਬੰਦੇ ਜਿਹੜਾ ਸੁਖੀ ਹੋਣਾ ਚਾਹੁੰਦਾ ਹੈ, right, which ਸਾਡੇ ਸਾਰਿਆਂ ਦਾ nature ਹੈ, ਅਸੀਂ ਸਾਰੇ ਸੁਖੀ ਹੋਣਾ ਚਾਹੁੰਦਾ, everybody desires happiness, ਕੋਈ ਜਿਹੜਾ ਦੁੱਖ ਨਹੀਂ ਚਾਹੁੰਦਾ, right? But ਜੇ ਅਸੀਂ ਸੁਖ ਨੂੰ ਚਾਹੀਏ, ਜਾਂ if we've chosen sukh over dukh, we've essentially chosen both, especially if we've chosen it for ਜੇ ਮੈਂ ਇਹ ਕਰਾਂਗਾ ਤਾਂ ਮੈਂ ਸੁਖੀ ਹੋ ਜਾਵਾਂ, right? We've chosen an external cause as a condition for being sukhi. But Gurbani tells us whatever external cause we choose, whether it's relationships, whether it's our own youth, whether it's our own health, that's going to change, right? Harik cheez may change ho jana over time. So if we choose any external cause, we've chosen both sukh and dukh. It's not possible to choose just one. So Guruji sanu kende tu dome sukh te dukh to utte utho. And this is actually something that we see clinically as well, because depression is much more than just sadness, right? People describe depression as kind of like a feeling of numbness, inability to feel really joy or sadness. Whereas normally our normal state is that when good things happen, we feel happy. When bad things happen, we feel sad. That's just being human. That's normal. But Gurbani says you have to arise above both states. You have to rise above dukh and sukh and seek anand or blissfulness. And that shabad that we had mentioned earlier, Jo sukh ko chahe sada sharan ram kile, that's what that's telling us. Surrender everything to God if you want to be always at peace, if you want to move beyond these negative mental states. So Gurbani tells us to arise above us. And what happens when we arise above it? What used to be dukh, what used to be kalesh, santap, chinta, parishani, becomes sukh, sahaj, anand. We regain our enthusiasm for life, because a mind that's burdened with anxiety, burdened with suffering, can't achieve those mental states. And Guruji gives us the very specific technique through Naam. There's actually a verse in Gurbani that is kind of the conclusion. Diktha sab sansar sukh na naam be. Right? Pura sansar, pura jagat mein veekh le. Naam to bina koi sukh nahi. Haan sanu lagega bhi sukh hai, par wo 4 dina da hunda hai, kyunki wo baarla sukh. So Gurbani ne faisla kita bhi, well, and you know what Mansi said is very true. Clinical depression is very real. It should be treated as a medical condition. But Gurbani sanu ek step agge leke jande hai, even je assi clinically depressed nahi hege, us to gaah vi avastha hegi jehde Gurbani makes available to us. And Gurbani also defines dukh, right? So jehda vadiya doctor hunda wo pehla diagnosis sahi karda, right? ਜਿਹੜਾ ਡਾਇਗਨੋਸਿਸ ਸਹੀ ਹੋਏ ਤੇ ਟ੍ਰੀਟਮੈਂਟ ਆਪੇ ਪਤਾ ਲੱਗ ਜਾਂਦਾ। ਸੋ ਗੁਰਬਾਣੀ ਇਹਦੇ ਤੇ ਬਹੁਤ ਜ਼ੋਰ ਦਿੰਦੀ ਹੈ ਕਿ ਦੁੱਖ ਕੀ ਹੈਗਾ, right? The greatest dukh, the greatest suffering according to Gurbani is Maya. Maya jebad dukh na koi. Because whatever we do within Maya, will bind us further to the illusion, will bind us further in our home, will make us more slaves to the five thieves. And keep in mind who's writing this, right? These are our gurus. Guru Arjan Dev Ji ne kinne dukh se, right? Tatti tavi te baithe, Guru Tegh Bahadur Sahib da unhone sir kalam karta, Guru Gobind Singh Ji de chare puttar vaate, te oh likh rahe hai माया जेवर इन्ने दुख जिहड़े सहंदे होए लिख रहे हैं भी इस तो वड्डा दुख नहीं है जिहड़ा बंदा माया दे विच ग्रसिया होया जीवन जीउंदा है. So this is another verse that kind of confirms this. Gujji pahe jale sansara. Gujji pahe means invisible fire, meaning ek anidrisht ag which jalda paya pura sansar par bhagat na vyape maya. People who are devotees of God, ਜਿਹੜੇ ਗੁਰਮੁਖ ਬਣਨ ਦੀ ਕੋਸ਼ਿਸ਼ ਕਰ ਰਹੇ, ਜਿਹੜੇ ਭਗਤੀ ਕਰਨ ਦੀ ਕੋਸ਼ਿਸ਼ ਕਰ ਰਹੇ ਹੈ, ਉਹਨਾਂ ਨੂੰ ਮਾਇਆ ਨਹੀਂ ਵਿਆਪ ਸਕਦੀ. ਉਹਨਾਂ ਨੂੰ ਮਾਇਆ can't haunt them. It can't take away their intrinsic happiness. So, and Gurbani also gives us a very specific definition of Maya. ਹੁਣ ਠੀਕ ਹੈ ਮਾਇਆ ਨੂੰ define ਕਰਦਾ ਹੈ ਵੀ ਇਹ ਪੰਜ ਚੋਰਾਂ ਦੇ ਨਾਲ ਸਾਡੇ ਮਨ ਤੇ ਕੰਮ ਕਰਦੀ ਹੈ, ਇਹ ਸਾਨੂੰ ਦੁੱਖ ਵਿੱਚ ਬੰਨ੍ਹ ਦਿੰਦੀ ਹੈ, ਪਰ ਮਾਇਆ ਹੈ ਕੀ ਹੈ, right? Normally when we think of Maya, we associate it with money, right? We associate it with those types of things. But Guru Amar Das Ji defines Maya. ਇਹ ਮਾਇਆ, this is Maya, ਜਿਤ ਹਰ ਵਿਸਰੇ, ਜੋ ਵੀ ਸਾਨੂੰ ਰੱਬ ਨੂੰ ਭੁਲਾ ਦਿੰਦੀ ਹੈ, right? That doesn't have to be money. That could be attachment. That could be our own ego, our own self-obsession, right? Maya is much more than just money. ਜਿਤ ਹਰ ਵਿਸਰੇ, ਜਿਹੜਾ ਸਾਨੂੰ ਪਰਮਾਤਮਾ ਨੂੰ ਵਿਸਾਰ ਦਿੰਦੀ ਹੈ, ਮੋਹ ਉਪਜੈ. ਮਾਇਆ ਦੀ ਨਿਸ਼ਾਨੀ ਹੈ it increases attachment to external things. ਭਾਉ ਦੂਜਾ ਲਾਇਆ ਤੇ ਹੋਰ ਚੀਜ਼ਾਂ ਨਾਲ ਭਾਉ ਦੂਜਾ ਹੋਰ ਚੀਜ਼ਾਂ ਨਾਲ ਪਿਆਰ ਵਧਾ ਦਿੰਦੀ ਹੈ. ਸੋ ਇਹਦਾ ਕੀ ਹੁੰਦਾ ਵੀ ਮਾਇਆ ਦੇ ਜ਼ੋਰ ਦੇ ਕਾਰਨ ਸਾਡਾ ਮਨ ਬਹੁਤ ਦੁੱਖ ਸਹਿੰਦਾ ਹੈ, ਤੇ unless we make an effort through Gurbani, through practicing Gurbani to go beyond it, there's no way we can achieve that stable mental state.
So now let's talk about anxiety. So, we all feel stressed, situationally. Just at a family which your work, place which could chal raha hai, it's natural to feel anxious. But it becomes a psychiatric condition when, again, it's so excessive, so constant that it starts affecting our quality of life. And anxiety, both types the we'll not discuss all the types of anxiety in this presentation, but some examples include social anxiety or specific phobias. But one of the very common psychiatric conditions is generalized anxiety disorder. It's essentially anxiety about everything. So according to the DSM-5, it's been described as having 3 or more symptoms out of these following symptoms for at least 6 months. So the symptoms include feeling restless, feeling keyed up, or kadi-kadi aisi vekhne that people keep pacing, they're always fidgety. So that's one symptom. The other one is feeling easily fatigued. Again, that draining of the mental energy. Pura din je banda anxious rehte, you just don't have the energy to do anything else. Difficulty focusing on things. Irritability. Jinanu anxiety hundi hai, they have a higher chance of feeling irritable. They snap easily at people. Anger de naal problems ho jandi hai. Muscle tension. Their shoulders, which their muscles tense up, their wrist muscles, they all tense up. So again, this is a common symptom of anxiety. And then sleep disturbance. Jene sare khayal man vich chal rahe hon, if you have ruminating thoughts, then it's so difficult to fall asleep and sometimes even stay asleep.
So understanding anxiety from the perspective of Gurbani, so kind of putting into context with the theory of mind that Gurbani discusses. So the most common theme that we hear from our patients is that I'm anxious and I want the anxiety to go away, meaning I chinta jai nahi rahi, and I can't live like this anymore, like daily worry, daily stress of what's going to happen next. And psychosomatic medicine or the mind-body connection is an area of significant interest because anxiety can affect us even physically, like our physical health. It can cause GI conditions like irritable bowel syndrome. It can cause non-epileptic seizures. It can cause even paralysis. Like we say that a lot in people who are veterans of wars. So anxiety can affect our physical health also. And you could consider it kind of like the modern plague, right? Such a fast-paced life, so much stimulation on our phones. We're dependent on our phones so much, constantly being bombarded with messages, emails, alerts. The words that are used in Gurbani are chinta, pao, pareshani, kada. And even though anxiety isn't listed as one of the 5 thieves, if we were to put it into context in the theory of mind, it could be thought of as an offshoot of moh, attachment. Because if we really think of it, why are we anxious, right? ਕਦੇ ਕੱਲ ਨੂੰ ਐ ਨਾ ਹੋ ਜਾਏ, ਮੈਨੂੰ ਇਹ ਚੀਜ਼ ਚਾਹੀਦੀ ਹੈ ਤੇ ਜੇ ਮੈਨੂੰ ਕੱਲ ਨਾ ਮਿਲੀ ਤੇ ਮੈਨੂੰ ਬਹੁਤ ਜਿਹੜਾ ਫਿਕਰ ਹੈਗਾ ਵੀ ਜੇ what if ਜੇ ਨਾ ਮਿਲੀ, ਜਾਂ ਕੱਲ ਨੂੰ ਇਹ ਹੋਇਆ ਸੀ ਤਾਂ ਕਿਤੇ ਫਿਰ ਨਾ ਹੋ ਜਾਏ, right? So we're attached to things being a certain way, or we're attached to a certain image we have of the future. And whenever that's disturbed, whenever that image of having a trouble-free future is disturbed, we feel anxious, right? And Kabir Sahib actually, he has a shabad that has the word pareshani. Bande khoj dil har roj. Kabir Sahib says, apne o bande tu apne dil vich khoj, na fir pareshani mai. Tu apne hirde vich vekh pi ter kede cheezaਂ ਨਾਲ ਮੋਹ ਹੈਗਾ. That's why tu pareshani vich fir rahe, right? So just apne hirde vich vekhe, we can see the things that we're attached to, and holy through Gurbani practice one of the virtues that we talk about, vairag, and ultimately counter it with the power of naam, making naam a habit, a part of our daily life. That's how we can overcome moh, which an offshoot of moh is anxiety. Sorry. So this is another thing that we wanted to talk about, that is the sense of self or the sense of me. And this ties into home, which home is common to both psychiatry and Gurbani. We talked about how psychiatry and Gurbani diverge. So the biggest delusion that we cling to in life is that our sense of self, our home, is permanent, right? That it's always going to be there. That's why wherever we're threatened with loss, right? Whenever we're threatened with loss of something we care about, we feel a lot of anxiety, we feel depression, because that's integrated into our home. It's integrated into our sense of self. And accepting that impermanence, accepting change, is one of the biggest teachings of Gurbani, and it also goes into hukam nu manna, right? Guru Nanak Dev Ji Japji Sahib ji sanu kande, Nanak hukm hai je bujhe ta haume kahe na koi. Just hukam nu bujh le, if we understand that har ek cheez Paramatma de hukum vich ਬਦਲ ਜਾਣੀ ਹੈ, ਸਾਨੂੰ ਉਹਨੂੰ ਐਕਸੈਪਟ ਕਰਨਾ ਪੈਣਾ, ਫਿਰ ਅਸੀਂ ਹਉਮੈ ਦੇ ਬੋਲ ਹੀ ਨਹੀਂ ਸਕਦੇ, ਕਿਉਂਕਿ ਹਉਮੈ is dependent on that stable, false sense of self. So Gurbani kind of leads us beyond this. In that same shabad by Bhagat Kabir ji says, Bande khoj dil har roj, na fir pareshani mai, eh jo duniya seher mela dastgiri nahi. Dunya is like, the world is like a magic show, right? Things exist one day, they don't exist another day, they come and go. Nothing is permanent in the world. And Guru Tegh Bahadur Ji kind of reinforces this concept even more. And he uses the word chinta. He says, Chinta taaki kijiye jo anhoni hoy. He says, main chinta ta kara if something was not expected to happen. Je koi anhoni hunde, if it was against God's natural law, if it was against God's hukum, right? But eh marg sansar ko nanak thir nahi koi. In this journey of life, nothing is permanent, right? Relationships are not permanent, health is not permanent, youth is not permanent, nothing is permanent. So Gurbani teaches us to gracefully accept this hukum of God and move beyond like the outcome of not accepting it, which is dukh, chinta, all the negative mental states we talked about. So, and then this also ties into the concept of ustat and nindya, right? Nobody feels bad jadon ਉਹਨਾਂ ਦੀ ਉਸਤਤ ਹੁੰਦੀ ਹੈ, right? ਸਾਰੇ ਬੜੇ ਅਸੀਂ ਫੁੱਲਦੇ ਹਾਂ, right? Oh, ਮੇਰੀ ਉਸਤਤ ਹੋ ਰਹੀ ਹੈ, right? But what we have to understand is ਜੇ ਅਸੀਂ ਉਹਨੂੰ accept ਕਰ ਲਿਆ ਤੇ ਅਸੀਂ ਰਾਜ਼ੀ ਹੋ ਕੇ accept ਕਰਦੇ ਹਾਂ, ਅਸੀਂ ਫਿਰ ਜਦੋਂ ਕੋਈ ਨਾ ਕੱਲ ਨੂੰ ਸਾਡੀ ਨਿੰਦਿਆ ਕਰਦੇ ਹਾਂ, ਫਿਰ ਦੁੱਖ ਨੂੰ accept ਕਰਨ ਲਈ ਵੀ ਤਿਆਰ ਹੋ ਜਾਓ, ਕਿਉਂਕਿ as we're building up our sense of self, ਸਾਨੂੰ ਕੋਈ ਦੁੱਖ ਨਹੀਂ ਹੁੰਦਾ, right? Structure ਨੂੰ ਬਣਾਉਂਦੇ ਆ ਕੋਈ ਦੁੱਖ ਨਹੀਂ ਹੁੰਦਾ, ਪਰ ਉਹਨੂੰ ਢਾਂਦੇ ਆ ਬਹੁਤ ਦੁੱਖ ਹੁੰਦਾ, right? ਪਰ ਬਣਾਉਂਦੇ ਆ ਪਤਾ ਹੀ ਨਹੀਂ ਲੱਗਦਾ, ਢਾਂਡਿਆਂ ਨੂੰ ਬਹੁਤ ਪਤਾ ਲੱਗਦਾ, even ਮਾੜੀ ਜੀ ਚੋਟ ਵੀ ਪਹੁੰਚੇ ਤਾਂ ਬਹੁਤ ਪਤਾ ਲੱਗ ਜਾਂਦਾ. So this sense of self is bound to param, illusion, it's bound to duvida, duality. So the central goal of Gurbani, as a guru, as a doctor, diagnoses us with this illness of home. He tells us the symptoms, dukh, pareshani, chinta, duvida, param, being slave of Maya, and he gives us the okhad, the medicine, which is naam, and practicing virtue. So, and the bigger we become, right, the bigger we build up our sense of self. Jinna si apne aapa nu vadaiye, ਉਸੇ ਤਰ੍ਹਾਂ ਜਿੰਨਾ ਉਹਦਾ ਪਰਛਾਵਾ ਵੱਡਾ ਹੁੰਦਾ ਜਾ ਰਿਹਾ, ਰਾਈਟ? ਜਿੰਨਾ ਜ਼ਿਆਦਾ ਅਸੀਂ ਆਪਣੇ ਸੈਲਫ ਨਾਲ ਅਟੈਚ ਹੈਗੇ, ਉਨੀ ਜ਼ਿਆਦਾ ਚਿੰਤਾ ਸਾਨੂੰ ਹੋਏਗੀ, ਉਨਾ ਜ਼ਿਆਦਾ ਸਾਨੂੰ ਦੁੱਖ ਹੋਏਗਾ, right? So Gurbani sanu sikhande pi inu a building nu banao na, right? Inu ta do jan guru nu de. So in an increasingly insane world in which we're building up our social media profiles, we're trying to increase our followers, we're trying to everybody's trying to become an influencer. So but this is essentially we're falling into the trap, right? In an increasingly insane world, following the teachings of our guru is perhaps the only way to remain sane.
So this is the final topic for today, substance use disorders. Next slide, please. So substance use disorders, understanding and treating them is becoming more and more important now. More and more younger people are presenting with addiction. We know that marijuana has been legalized in many states, and in our clinical practice we get a lot of people who are addicted to marijuana, tobacco, alcohol, these kind of substances. And oftentimes there is peer pressure, the need to fit in, social media influence, jide karke, more younger people are getting influenced and they want to try these substances. And they can have really severe ramifications. People are having health problems, schools which another performances bachyan di kharab ho rahi hai, and so many medical problems, especially aajkal jade tobacco, vaping and juuls and aisa aa gaya hai. With that, so many younger and younger children, they are developing lung problems. And we all know about the opioid crisis in this country, which has already claimed so many lives. So, addiction can be fatal, and it often remains unaddressed because of the stigma or shame associated with it. So, Sadi Punjabi community, which we have, seen a lot of people jade alcohol no use karde hai, and oftentimes jade words people use against them like "aite nasheri hai, aite sharabi hai," that makes it very difficult for the person to seek treatment. We start labeling them, and that just turns it into a stigma. And now, the more we know about substance use disorders, we know that there is a strong genetic basis, of addiction. Jinanu addiction hegi hai, ਉਹਨਾਂ ਦੇ brain which there are chemical changes, there are even structural changes, ਜਿਹਦੇ ਕਰਕੇ once they go into recovery, it's so difficult for them to feel the same level of happiness and pleasure that they used to feel before. So it essentially is just like any other medical condition. That treatment should be just like any other condition like diabetes, hypertension, low thyroid. So in the Punjabi culture, as we discussed, this is alcohol use is more prominent than tobacco use, and we'll discuss a little bit more about that in the next few slides. So the first tool to deal with addiction is to be empathetic. Kisi nu eh kehna ki they're doing it by their own volition, and ane start hi kyun kita, and trying to just having that stigma against them makes it even more difficult to treat these conditions. There are so many programs nowadays like detox centers, there are residential programs, there are AA, NA meetings. All of that is necessary to have these wraparound services to help people who are dealing with addiction. And alongside that, there is medication associated assisted therapy. So there are a lot of medications that can help with cravings for substances. So if somebody is struggling with addiction, jado sanu kende ki I'll stop this by myself, mainu kisi help di lod nahi hai, that actually is very difficult. So we recommend a combination of therapy, a combination of these support groups and medications as necessary for treatment. Next slide.
So if we were to understand addiction from the perspective of Gurbani, so Mansi is absolutely right that these are diseases. They're actual illnesses that can be treated. And if we don't treat them as illnesses, then they'll go untreated. People won't talk about them. They'll kind of recede into the shadows out of fear of judgment. But Gurbani also talks about substance use. And so we all know that in Sikhi, like very few Sikhs smoke because it's culturally, like it's actually one of the Bajra it's one of the cardinal sins within Sikhi. And culturally also, it's known that Sikhs don't smoke. But Guruji 500 years ago wrote in Gurbani that don't use pan, supariyan, bidiyan, And we'll talk about that specific verse from Gurbani, but it's remarkable because just 50 years ago in this country, the tobacco companies were trying to prove that cigarette smoke is not, and cigarette smoking and secondhand smoke is not harmful. People were allowed to smoke in buildings. But Guruji said 500 years ago, pan supari khatiyan mukh beediyan laiyan, meaning they consume tobacco products, supariyan, beediyan, and in this way they waste their life. Har har kade na jeteo. They never use their life for a good purpose, remembering God. Jam pakad chalai, and they're grabbed by the messenger of death. So the Guru steered us, and we all know that story, Jado Guru Gobind Singh Ji da Koda, tobacco de field to jaan to inkar karta hai. Guru Gobind Singh Ji da Koda had that much wisdom, bhi jada at tobacco de field de nede bhi nahi jana. So this is something that's been instilled to us in our tradition. But this may be less well known that Gurbani also prohibits the use of alcohol, right? We may have even heard in conversations in our family, oh, theek hai, chalo, nahi smoke nahi karna, par chalo sharab. But actually Gurbani prohibits both of them. So there's a specific verse in Gurbani, Jit peete mat dur hoy. Jide peen nal our understanding, our intelligence, vivek buddhi is taken away. Baral pavai vich aaye. Baral means kind of a craziness enters the mind. Apana paraya na pachani. They're describing the effects of the substance. We're no longer able to recognize apana keda paraya kya. We're not able to recognize what's good, what's bad. Khasmo tak ke khai. And we're God himself, like, because of our actions, we're pushed around because of this, if we indulge in the use of alcohol. So then koi jana kahega chalo unni na piyo pi jinne to na tadi mat visra, par thodi is that allowed? But Gurbani also addresses that. Guruji says, Chutha mad mool na piche. Do not drink the false nectar at all. So Gurbani also, this should be very clear that Gurbani also prohibits the use of any sort of intoxicant, and there's specific instructions from Guruji that prohibit us from also using alcohol. The other one, which is nowadays among the youth very popular, is marijuana, right? You'll hear young people tell, oh, I don't use any substances, I just use marijuana, right? But we know marijuana, as psychiatrists, we know marijuana has very harmful effects on the mind. It can alter our thought processes, it can make us less motivated, it can cause us to even hear voices, feel paranoid. There's a lot of young kids who get hospitalized. They have no family history of mental illness, but they get hospitalized because they start feeling paranoid or hearing voices because of using like large amounts of marijuana. But Kabir Sahib, even before the time of our Guru, said, Pang, machli, surapan, jojo prani khai. Bang or marijuana, machli, fish, surapan, tobacco products, jojo prani khai, whichever human being consumes them, tirat vart name kiye sabbe risatar jai. Whatever religious merit, whatever actions they did to accrue religious merit, they all go to waste if we use these types of substances. So while we should recognize substance use disorders as very real and we should seek treatment when they happen, we should also recognize that our Guru kind of from the very beginning has prohibited these things as very bad for our mental health. We really appreciate we really appreciate that, and we'd like to thank everybody once again. Now we have some time for questions. Waheguru Ji Ka Khalsa.
I have never seen a sign, doctor, psychiatrist. I have never seen in my life. Do they exist in the hospitals? Where do you psychiatrists practice?
That's a really good question. So psychiatrists, honestly, it's only gained, mental health has only gained prominence in recent times. Historically, people saw it as a big stigma to see a psychiatrist. So psychiatrists are everywhere. They're in outpatient clinics, say clinic te jao te okay psychiatry they be clinics they get hospital retreat, there are consulting psychiatrists, inpatient psychiatric centers, substance abuse centers.
So
in fact,
every hospital would have a psychiatry department?
Yes, every hospital has to have a psychiatry department. In fact, Obamacare, there was a change to the insurance that insurances have to cover psychiatric care, including substance abuse care, to the same extent that they cover medical care.
Okay, thank you.
But good question. So, other questions?
I just want to add, but हमें एक लाइन होती है ना, हमें दीर्घ रोग है, दारू भी स्पा है ना,
हाँ
दारू भी, it means medicine, it's inside it, right? Okay, that you are feeling yourself, that you are there present inside thing. How do you take that?
Yeah, so that's a really good question. So what he asked was that आसादीवाद एक तो कह गया हमें दीर्घ रोग है, भी हमें सब तो बड़ा serious रोग है, पर दारू पी इस माहे. This also has the solution hidden within it. But the next line kind of tells us more about what that's a kirpa kare je apni ta gur ka shabad kamaye. So jiri homme that was leading us towards mind-oriented activities, right? Towards kaam, krodh, lobh, moh, ahankar. If that same homme, that sense of self, we surrender to the Guru, te assi Guru da shabad nu kamande hain. Then for that homme is basically a motivating force, right? Whatever we do, we're motivated by our sense of self. The only problem is that sense of self is attached to worldly things. It's attached to the mind. ਜਦੋਂ ਅਸੀਂ ਉਹੀ ਹਉਮੈ ਨੂੰ ਗੁਰੂ ਵੱਲ ਲਾ ਦਈਏ, ਦਾਰੂ ਉਹੀ ਬਣਦੇ, ਕਿਉਂਕਿ ਅਸੀਂ ਆਪਣੇ sense of self ਤੋਂ ਬਿਨਾਂ ਕੁਝ ਕਰ ਹੀ ਨਹੀਂ ਸਕਦੇ, right? ਜੇ ਅਸੀਂ surrender ਕਰ ਰਹੇ ਹਾਂ, ਅਸੀਂ ਕੀ ਕਰ ਰਹੇ ਹਾਂ, right? ਅਸੀਂ ਆਪਣੇ ਹਉਮੈ ਨੂੰ surrender ਕਰ ਰਹੇ ਹਾਂ. So that sense of self becomes motivated to do Naam Simran. It becomes motivated to go to Sangat. It becomes motivated to abandon vices. So दारू भी उदे विच ही है, पर trick is जे ਅਸੀਂ ਗੁਰੂ ਦੇ ਸ਼ਬਦ ਨੂੰ ਕਮਾਈ.
I have a question here.
Hanji.
In the last slide, I think you mentioned something like that substance abuse, like something like machli. I was not sure that machli is prohibited, or what are the side effects of machli?
People say machli is
fish.
So that's a really good question. So Kabir Sahib di tuk par aisi gal kar rahe hain. So udhe vich Kabir Sahib ne, where he talked about Surapan and Pang, he also talked about machli, which is, that topic is not relevant for substance abuse, but so that's a completely different topic, right? Mas and Gurbani, which is actually like a controversial topic. But Kabir Sahib does have other verses that kind of say like against meat, but it's separate from mental health. Like there's verses like जो सब में एक खुदाई कहते हैं तो क्यों मुर्गी मारे, right? So and then there's other verses, but ultimately Guru Sahib says like mas kar murak chagre. This is not something that we should argue about, or it's not the biggest issue, not as big as like काम क्रोध लोभ अहंकार निंदा जुगली, those issues that are the main issues. But हाँ ਤੁਹਾਡੀ ਗੱਲ ਬਿਲਕੁਲ ਸਹੀ ਹੈ, ਕਬੀਰ ਸਾਹਿਬ ਨੇ ਉੱਥੇ ਮੱਛੀ ਵੀ ਲਿਖਿਆ ਉਸ ਤੋਂ ਕੁਝ, but it's a separate issue from Pang and Suraka.
ਲਾਸਟ ਟਾਪਿਕ ਦੇ ਵਿੱਚ ਤੁਸੀਂ ਕਿਹਾ ਸੀਗਾ ਕਿ ਜਿਹੜੇ ਬੱਚੇ ਥੀਵਸ ਕਰਦੇ ਆ ਜਾਂ ਮੈਰਿਜੂਆਨਾ ਲੈਂਦੇ ਨੇ, ਤੇ ਉਹ ਜਦੋਂ ਤੁਸੀਂ ਹਸਪੀਟਲ ਦੇ ਵਿੱਚ ਜਾਂਦੇ ਹੋ ਤੇ ਉਹ ਲੋਕ ਕਹਿੰਦੇ ਕਿ ਇਹਦੀ ਕੋਈ ਮੈਡੀਸਿਨਸ ਨਹੀਂ, ਤੇ ਉਹਦਾ ਕਿਸ ਤਰ੍ਹਾਂ ਇਲਾਜ?
Hanji, so vaping, tobacco use, there are medications, the nicotine patches, nicotine gums, prescribed ho sakde ne. So ਇਹਦੇ ਨਾਲ nicotine ਦੀ craving ਨਹੀਂ ਹੁੰਦੀ. There are other medications like Chantix. Marijuana ਲਈ there are no medications that I know of, but you know, with therapy, with constantly educating people, that's the best we can do right now with marijuana.
Jada AA program, is it there for, or jada NA program, can that help too?
So AA is Alcoholics Anonymous, NA is, you know, for I think it's nicotine. Narcotics Anonymous.
Raji, do you want to add anything on the marijuana? If you are knowledgeable, if you feel.
I don't, not too knowledgeable about NA, but it is a drug step program. So a drug step program which actually literally follows very much like, sir, as you were suggesting, you know, Gurbani, you know, firstly surrendering and then going through inventorying and finally eventually turning it over at the end of the day to a higher power.
Yes.
So that's really one of the, as you were suggesting, you know, there's medical, there's therapy, and of course there's support groups. So certainly NA is something that they use for not just marijuana, but any substances.
Yeah, and for narcotics, I mean, for opioids, I mean, there are medications like, you know, methadone, Suboxone, there are specific clinics for that. But yeah, so these, you know, 12-step programs or these AA, NA meetings, I think, you know, as we were discussing, they believe in that higher power, surrendering to that higher power. So that's very similar.
Is marijuana a narcotic, or is it opioid, or what is it? What is the class?
It's a different category. It's cannabinoids.
Cannabis. ਉੱਥੇ question.
I have a question. These days, there's so much anxiety related to social media, especially among this certain age group. And if we talk about that, it seems like every single teenager or a certain age group is on the edge. Now, do we call that every single of them has a chemical imbalance, or how do we really treat that? If that's, I think to me that is the topmost anxiety prevalent among the, the youth.
Especially among the youth, nowadays with social media, with peer pressure, these psychiatric conditions, they have skyrocketed in the younger population. So again, we have to diagnose it based on DSM criteria and how they're functioning. It's on the rise, and if they're diagnosed with generalized anxiety disorder or there are like social anxiety disorders, some younger people or even older people, they don't want to go in social settings, they're so afraid, or some specific phobia. So once they're diagnosed, there are specific types of therapy. Like for generalized anxiety disorder, there is cognitive behavioral therapy and medication. So there's a lot of medications that we use. It's unfortunate, it's really, really going up with the younger population.
Couple of questions. Can you talk about where people can go if they need to see somebody like yourself or Simran? What is that? Yeah.
So, you can, approach your primary care physicians, and they can refer you to psychiatrists. In a hospital setting, there are consultants that can see you. Like, let's say if somebody's hospitalized and there's a psychiatric issue, there is a specific, separate CL team that can see you. You can. What are some of those?
Yeah, so I think, like Man's was saying, the best place to start would be like your primary care doctor. And then they're usually the ones that make the referral. Like if the problem is something that it can be managed like outpatient, right? If you feel like their life is in danger, right? If they're suicidal or if they're using substances so much that it could really cause harm to them, then you wouldn't want to wait to get an appointment with a psychiatrist because they can take like a month, 2 months. You'd want to take them to like a rehab facility or inpatient hospital. But if it's a problem like, let's say, depression without suicidal thoughts or anxiety or other conditions that are not urgent, then starting with the primary care doctor is good. Then they can refer to a psychiatrist. That's usually how most people come to us, like through the primary care doctor.
Yeah, I think also for those, if you have school, then school social workers, it's a good place to start.
Exactly. Yeah, that's actually a really good. So school counselors, school social workers. If you work part of a company, right? Companies have whole employee assistant programs also. So the HR department at most companies have mental health integrated into them. The other option is if it depends on your insurance, you could even see which psychiatrists are covered under your insurance and make appointments directly with the psychiatrist. But it kind of, there's a lot of insurance. Most people go through primary care doctor, but some people do come to us directly through their insurance. But there's employee assistant programs, there's school assistance programs. There's also if we don't have insurance, there's free mental health clinics like in Detroit. I know at the Gurdwara also they offer some services. So, but psychiatry, even though it may take a month or two to get an appointment, there are a lot of psychiatrists in the community who are out there and willing to help.
Thank you so much for connecting the spirituality of the psychiatry, the substance use with the Gurbani, because I think it's a very relevant topic. Wanted to ask, in your clinic setting, do you also suggest the patients when they're coming in with depression, anxiety, or substance use, do we suggest them that they should connect spiritually with their guru, with their religion? Not only in Punjab community, I'm thinking that you see some Christian people do, some Muslim people do. Is it encouraged for them to go connect with their so-called Lord, let's say?
Yeah, so that's a really good question. So do we integrate some of these principles into our practice? So we have to be a little bit careful because we don't want to bring like religious concepts into a setting where people, they may not believe in the same things we believe in. They might take offense at, if we suggest anything that has religion based. But if a patient themselves brings it up, or if they themselves as a part of their faith system, they bring up a concept that is similar to Gurbani, then that's something that we definitely talk about, that, you know, this is something that we believe in also that's very similar. This is how you can use it in your daily life. There's actually something that's very popular right now, like mindfulness, something that is kind of distilled from Eastern traditions, that some of the principles are very similar to Gurbani, like being neutral to happiness, sadness. So mindfulness is a type of meditation that has gained wide acceptance, even though the basis of that is religious, but they've kind of distilled it from its religious roots. It would be interesting to see, and this is something that I don't think has been done, but like distilling like the concept of Namsan, right? Reciting Vaheguru from its religious background, and can that benefit? There have been studies of that with like other Gurmantras with other religions, but in Sikh, I haven't seen any study like that, but it would be interesting to see. But the short answer is, we try to, a lot of these principles are universal, right? Accepting what happens, right? Not getting caught up in excitement or getting caught up in despair, depression, right? Remaining neutral. These are universal principles that are part of every religion and are actually good, sound psychological tools, right? So they're integrated into a lot of our psychotherapies. There's a specific psychotherapy called acceptance and commitment therapy. That's basically, another way of saying surrendering to hukam, right? But we try not to like use religious terminology.
But we've seen that like having some sort of like religious orientation, like let's say if somebody goes to church, it's actually a very strong protective factor against mental health conditions and even suicide. So whatever a lot of patients tell us that, okay, I go to this church, or I go to the mosque, and we try to encourage them to do what their practice is, and it's a very strong protective factor.
Yeah, even socially, like being part of a community is very good. So the studies have shown that if you're socially integrated, if you're part of a community, you're less likely to develop major depressive disorder. You're less likely to have a relapse. If you've had depression, you're less likely to have a relapse. So whenever somebody tells us they're part of a faith community, that's something that we tell them, like the positive mental health benefits.
I mean, there's a one-liner there. They say the opposite of addiction is connection. You just brought it up. Connection. Whatever that connection is.
Yeah. And that actually is relevant towards what we discussed earlier too. Like nowadays with social media, we seem like we're connected, but we're more disconnected than we've ever been. Like, right? How many times do we do like FaceTime or like texting versus actually having a conversation with somebody, right? Which our brain needs that, right? Studies have shown that if you don't have actual social connections, dementia happens faster, right? So you need to see new faces, you need to talk to people to prevent depression, to delay the onset of dementia, or to prevent dementia. But that's something we're deprived of in this digital age. We're just addicted to our phones.
And in that way, I feel like Gurdwara is a very helpful resource. I mean, there is obviously religious activity, but at the same time there is a sense of community and meeting like-minded people, having that conversation. So it's a very positive influence.
Is there any question there? You have any question in the back?
Given the Botapani community, your communication barriers, older parents may status, ਤੁਸੀਂ ਦੱਸਿਆ ਕਿ ਮੰਨਿਆ ਜਾਂਦਾ ਕਿ ਇਹ ਇਸ਼ੂਜ਼ ਚੱਲਦਾ ਹੈ ਪੁਰਾਣਾ ਸੋ ਕਈ ਵਾਰੀ ਉਹ ਲੋਕ ਕਿਸੇ ਨਾਲ ਜਾਂ ਪ੍ਰੋਫੈਸ਼ਨਲ ਕੰਟੈਕਟ ਕੋਈ ਆਪਣੀ ਕਮਿਊਨਿਟੀ ਦੀ ਆਰਗੇਨਾਈਜੇਸ਼ਨ ਹੈਗੀ ਹੈ ਕਿ some people can reach out and talk or they go help us.
ਇਹ ਨਾ ਜੀ ਸੋਚਿਆ ਹੈਗਾ ਇਹ ਜਿਹੜਾ ਹੁਣ what we have started here, the goal ਇਹਦਾ ਆਪਣਾ goal ਇਹੀ ਹੈ ਕਿ we will actually go into something like that, have maybe counselors. We are just starting to draw attention to the mental health issues in our community. Now I can suggest there is a masjid in Detroit. They have a full-fledged 5 counselors, mental health counselors on their staff, and it's being run by a doctor himself. So I think it's called, I have an article, I've spoken to the guy, I can give you that resource. ਉਹ ਲੈਂਦੇ ਨੇ plus Dr. Haminder, he's also a psychiatrist, and he had brought his colleague who is a maybe physician assistant who can, maybe you can use that individual as a starting point. But it is a need. It has been identified through our Gurdwara committee that that's where we are heading, hopefully sooner than later.
There's one in Farmington also, they have a hotline and it's mainly like for Indian community. I think that's so they have counselors rapidly available, like on call, like hotline prices and stuff.
If you're on Gurdwara website, Gurdwara ਦਾ ਜਿਹੜਾ WhatsApp group ਤੇ ਤੁਸੀਂ ਪਾ ਦੋਗੇ ਉਹਦੇ ਤੇ?
ਹਾਂਜੀ,
that'll be very, very good.
ਉਹ ਜਿਹੜਾ WhatsApp group ਹੈ ਉਹਦੇ ਉੱਤੇ ਜੇ ਪਾ ਸਕਦੇ ਜਾਂ ਤੁਸੀਂ ਪਾ ਸਕਦੇ।
ਹਾਂਜੀ।
There was one person who gave a speech a couple months ago. The one who said I was engineer before, now I'm helping out.
Yes.
I forgot her name. She gave a speech here too.
Yes.
This is a very good resource.
But
I guess all these resources, should go on our
No,
website.
I'll give it to
Yes.
them, whoever is the admin, they can put it.
Yes, if you can just share. Now, lost my chain of thought. Sorry, it'll come back to me.
It'll be good to have some meditation.
So before everybody leaves, and first of all, let's join me in doing a jakara for Dr. Simran and Dr. Mansi. Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh. What a wonderful way to connect us. But we are, as a follow-on to this, they are going to help along with Gagan Penji. We are going to do a Simran meditation Sarabro Ka Akhadnam camp. We are planning on 29th March. They have put it on their calendars, 2 to 6. As a way, Dr. Haminder and Raman Penji had also given us some ideas even before. So we're going to take all that and try to come up with something for our Sangat. We'll see how these have been very well attended, but we don't know what will that look like. But there is a upralla karna, koshish karni hai. We are going to make an effort to do that. But that's only going to be successful if Sangat themselves participates. It's nothing that we know more than anybody else. It's just everybody bringing their best ideas. Gagan Penji has Sarabro Ka Khudnam, which is another way of saying that Naam is the cure for all the diseases, which Dr. Simran and Dr. Mansi referred. So our goal would be to actually make it a little bit more live and draw that connection. I think with that we'll conclude. Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh. Thank you so much for making that effort.
Thank you guys for the